Hello, my name is Brandy Patrick, and I've been a labor and delivery nurse for 11 years. And I'm going to talk to you today about peanut balls, which are my favorite labor tool. These particular balls are from Premier Birth Tools, and this green ball is 40 centimeters, and this is for women less than 5'3". This one's 50 centimeters, and it's for 5'3" to 5'6". This red one is a 60 centimeter ball, and it's for women who are greater than 5'6". And then this is the largest ball, 70 centimeters. And this ball is only for kneeling and straddling on the floor, so it should not be used in the bed. It's very important to size a patient correctly. So those are rough guidelines. There may be times where the same patient may need a different size ball for different positions. So the important thing is just to remember, make sure that you are sizing correctly. And I'll show you a little bit more of that here in just a few minutes. The most important thing is to listen to the patient. You want to make sure and use proper body mechanics, and the ankle should be rested on the peanut ball, not hanging all the way over. Make sure to choose the correct size for the position and the patient. Okay, contraindications to using a peanut ball are a broken hip, broken pelvis, broken symphysis, and also if the patient's had a previous hip or pelvic injury. Those would be the reasons. Otherwise, the peanut ball is a low intervention tool, and it's a nursing intervention, so you don't need an order, and it's a great way to help baby rotate and move down in the pelvis. Peanut balls should be covered during use, and you can use a patient gown, you can use a chucks, you can use a sheet, a bath blanket, but it should be covered. And then it can be cleaned with soap and water, vinegar and water, or like the purple Stanley wipes. Do not store these peanut balls on the floor, so they need to be off the floor and put away from any sharp objects. One of the things that I really like from Premier Birth Tools are these charts that they have. This is a set of 5 pages, and it goes over a lot of different peanut ball positions. So these can be taken into the room. You can show the patient the positions and use them to kind of help the patient get into position. We have these at our nurses station in a plastic 3-ring binder so that we're able to take them into the room, but we also still have them available for the nurses as well. So this first one talks about internal and external positions, and then it shows you how to do each one of those. It does have some positions that are in the bed, some positions that are on the floor with that 70 centimeter ball. This particular area here talks about how their feet should be and how knees should be as related to the pelvis. So inlet, mid pelvis, and outlet. So that just kind of gets a visual there. And some more peanut ball positions. These ones are really popular, the side lying tuck and semi-sitting lunge, which we will show you. This particular area here I think is pretty cool. In the past we've used a stirrup to kind of open up their pelvis, and you can see the difference in the stirrup and the peanut ball and how much that opens up the pelvis. And then some other positions. And then there's some more new positions. And then I love this one. So this is the peanut ball pushing positions. This one is just very helpful. There's a lot of different positions that kind of help baby rotate, help baby move down in the pelvis. And I think it helps the patient feel more comfortable as opposed to just being in stirrups pushing. Okay, so Olivia and I are going to show you some of these positions. Olivia is going to be my model. She is also a peanut ball ambassador and a labor and delivery nurse, and we have been working on a lot of this together. So we're just going to demonstrate some of these positions. So the first one is with this 70 centimeter ball, which is only to be used on the floor. So Olivia, I'm just going to kind of show you these. So with this particular position, when you are trying to open up the inlet, you are going to bring your legs out to the side. Yep. Yep. And then she is going to point her feet out. Perfect. And then the same way we can also open up the mid pelvis by straightening up her feet. All right, and then the outlet by turning her toes in, yes, and heels out. The other thing is we'll show you like if you sit on it as a bench, so turn to the side. And it is good to be close to, there you go. And then the patient can kind of rock, move her hips around, and sometimes that's just really comfortable for laboring moms. Okay, so now we're gonna show you some peanut ball positions that are good for opening up the inlet of the pelvis. So this first one that we're gonna try is the semi-sitting lunge. So Olivia's sitting up in bed. She's going to bend this leg underneath. Now this is the 50 centimeter ball. Olivia, how does that feel?
It's uncomfortable.
So this position, this is uncomfortable for her. This ball's definitely too big for her. Olivia is 5'1", so we are going to use the smaller peanut ball. All right, Olivia, how does that feel?
It's more comfortable.
Okay, perfect. So this position helps, again, open the inlet. Next, we'll show the flying cowgirl. And I'm gonna, Olivia beat me to the punch. All right, this peanut ball goes between the ankles here. And so one of the pictures on our charts kind of has someone reaching back and grabbing the peanut ball, which I'm not sure any pregnant woman could do, except for the model, of course. But it kind of gives you an idea of that kind of position. And this, again, opens up the inlet. All right, and then the other one that I want to show you is the positions that open up the mid-pelvis. All right. So first, we're going to do our favorite, which is the tuck position. One thing about this is important is kind of have the patient scoot all the way back towards the back of the bed. All right, and then we are going to put this peanut ball between her legs. And then I'm gonna have Olivia reach down and kind of pull that up to her chest. All right, and you can kind of see this opens up the pelvis. This is a great position for pushing as well. We do this like pretty frequently. This is probably the position that we use the most. It's just very versatile. It opens everything up and babies seem to move down pretty quickly. And then we'll show side lying, which is similar to this tuck position, only the legs are down more instead of pulling it up towards the chest. Sometimes you'll need to put a towel or something to kind of hold the legs in place. How does that feel, Olivia?
Comfortable.
Comfortable. So this is a great position for them to rest. If they don't have an epidural, but they need a little bit of rest, this is a great position to still kind of open up that pelvis. Because with all these positions, we're trying to simulate the movement that a patient would do in labor without an epidural. All right. Now we're gonna do runners. And this position helps babies rotate and come down. So this bottom leg is gonna be straight, okay? And then the peanut ball, she's gonna rest this leg on there. Now the top of her body is gonna be rolled over towards the bed, so she's almost on her stomach. And I'll usually give them a pillow to put right here between this arm and her head. This is also a really comfortable position and does a great job of getting baby to turn his or her head. All right, the last thing that I'm gonna show you is a knees together pushing, which is pretty exciting. Olivia, I'm gonna have you go ahead and get on your hands and knees. So when we're opening up the outlet of the pelvis, we want her feet to be out farther than her knees. So it doesn't really matter whether her legs are farther apart or closer together. We just want her ankles to be out farther than her knees. So and this opens up that bottom part of her pelvis. So we can push in this position, and it doesn't necessarily have to be on her back. We can do it on the side. And we can also, Olivia, I'm gonna have you go ahead and turn around and lay down. So we can also have her support person on one side with you on the other side. And this would be what that looks like for pushing closed knees. So the knees are as close as they can get them with their feet farther out. All right, that is all we have for today. Thanks for listening. I'm so excited about the peanut ball and I hope you guys are too. Thank you.